Hi, and welcome back to In the Hot Seat with Emily Diala and Dr. Viviana Coles. I'm Emily, and this is Dr. Coles.
Hi, guys.
And this is our third episode, wrapping up our series on problematic sexual behavior, which is what we're going to refer to it from now on.
It's also known as sex addiction, but for us, it really does fit to say that it's problematic, whether it's for an individual or a couple. And oftentimes, the couples or individuals who come in to see us, we want them to figure out why this is problematic. Is it something that's coming from maybe a childhood message about sexuality that they're not copacetic with, or if they're experiencing problematic sexual behavior as a faulty coping mechanism?
Yes, exactly.
And for individuals who are experiencing problematic sexual behavior, I'm often asking them to journal. I want to get a baseline. What are we dealing with here? And sometimes it's about giving them perspective. We may be the only person they've ever spoken to about this sexual behavior or any sexual behavior, and they don't have a frame of reference. So coming to talk to a professional, it really helps them to kind of see it from taking a step back versus being in the middle of it.
No, I do think there's a lot to be said for helping them, for facilitating their own processing and understanding, how the behavior fits into their life, what effect it's having on their life, whether there's a positive or negative effect. And then I think once they have a better understanding of the behavior, we like to help strengthen empathy with their partner. So again, if it's creating a problem in the relationship, what I like to do for them or have them do is write a journal from their partner's perspective so that they can understand how this behavior may be impacting the relationship from their partner's point of view. Because I think that's where a lot of couples, have trouble.
This has nothing to do with you.
Right.
You didn't even know about it.
Yeah, people can get very defensive or shut down. I think that comes from maybe the feeling of shame or guilt that they have about the behavior.
And then some of the other kind of strategies that we'll have in treatment or just in therapy in general is helping them to realize that how much of their resources, energy, financial, time resources, are they investing in this problematic sexual behavior, and what would they prefer to have and why? So sometimes it's as simple as, I got caught looking at pornography at work and I almost lost my job. I'm on probation now. Okay, let's talk about that. What were you looking for? Why at work? Is there too much downtime? What can you be doing instead? And some of those things are very simple, but other times the habit that they've created is really hard to break. And so it takes weeks of retraining, of thinking about things differently, of coming in and sharing your experiences, especially when they're difficult, especially when you feel like you've really struggled. That's when you want to come in to talk to your therapist about it. Not when things are going great and you get to say, oh, everything's been going awesome. Well, that's great. We're really happy for you. But when you're really struggling to make sure that you're either, depending on what the behavior is, avoiding altogether or minimizing, or being more communicative and honest about the behavior with your partner, that's when we really want to hear from you.
So, I think once you've helped them, learn those strategies, once they've understood the behavior, once they have maybe learned some new coping mechanisms to replace the behavior with, if you want to go a little deeper, as we said before, sometimes problematic sexual behavior is secondary to an unresolved issue they had from their childhood. I would say a pretty high percentage of these people that are engaging in more extreme behavior or risky behavior have their own history of abuse or neglect or some kind of trauma from their childhood. And so that's when the deeper therapy really comes into play. And I think we probably both, do different kinds of trauma treatment to treat those unresolved issues. Because I think what happens is, the shame or the fear that they had at the time of the original trauma is not resolved, it's carried forward, and then they're acting it out in a way that has become unhealthy for them or for their partner. So really what you have to do is go back in time and work out the original trauma.
In kind of layman's terms, it would be going back and trying to rewrite the story to be something that's more empowering versus feeling like you're at a deficit through that experience. Now, sometimes, people are coming in, especially if they're coming in as a couple, and it has a lot to do with someone is feeling left out. and feeling like this problematic sexual behavior is taking away from the partner. Those sorts of things tend to be a little bit more global with problems in the relationship in general.
Right.
When you are offering more time and investing more time in behaviors that are outside of your relationship, that can be something that, whether it's sexual or not, is really hurtful, and it hurts people's feelings, and then they become threatened by it. So that could be anything. I mean, it goes so far as fishing. I mean, it could be anything.
Yeah, in the last episode, we talked some about some of the pros and cons of the, traditional sex addiction treatment model. I think one of the other drawbacks of that model is a lot of times they'll recommend that people have like a 90-day abstinent period completely from any sex, any masturbation. And I think it's so important to help the couple reestablish their own erotic connection as early as possible. Teach them about healthy sexuality as soon as you can, because instead, I don't think you want to cut people off from their sexuality. As soon as you can, you want to start educating them about healthy sexuality.
And it's not even possible to really cut them off.
No.
And so they're going to, basically, you're setting
them
them up for failure. You're going to set them up for failure. And then oftentimes I get couples who will say something along the lines of, well, we thought you were doing that whole reverse psychology thing when you asked us to only do this or try this. And it made us want something else more, and we thought that was the point. Okay, no, I'm pretty direct, and I'll let you know if that's the case. But if you're experiencing those things, I certainly don't want you to feel like you're ashamed of it, or you as a couple can't make your own decision about what kind of sexual activity you want to engage in.
Another way of looking at problematic sexual behavior, I think, is through the attachment lens. I think a lot of these people have a hard time developing a healthy attachment with their primary partner. Again, a lot of times that's rooted in childhood. Maybe they had an insecure or an avoidant attachment with their primary caregivers growing up. So rather than allowing themselves to be seen and to be vulnerable with their primary partner, they're having this secret life on the side. And there really are ways to negotiate some of that into a relationship. And it's really about harm reduction and negotiation and figuring out what works best for both of you.
Exactly. It doesn't have to be an all or nothing approach. And I find that, with our clients, it's definitely, all or nothing just tends to not work in the long run.
I think a lot of people have their minds made up about what they will or will not do sexually, and so I try to help couples open the lines of communication and see if they can negotiate some of the behaviors in a way that doesn't go outside anyone's moral compass, certainly isn't illegal in any way, shape, or form, and that works for them in a way that they feel that both of their needs are being met, and hopefully more fulfillment in their relationships
and more long-term fulfillment. A lot of times people are very concerned about their sexual relationship feeling stagnant, and it's not just like okay, let's try some BDSM stuff, and it's not about that. It's about finding these core likes and preferences and interests, and finding ways to incorporate them in the long term, because then you really can have a very sexually fulfilling life together.
I think a lot of people have a specific sexual desire or fantasy that they think is completely abnormal, so they'll go to the internet to see if there's
abnormal.
Where there's everything out there, rather than maybe just talking with their partner about trying it, because they're too afraid of what their partner's reaction is going to be. So I really think that there is room to renegotiate and to get rid of the qualities that aren't working or the behaviors that aren't working, and find ways that you can reincorporate what does work into your relationship for long term.
We'd love to hear what you have to say online on YouTube, Facebook, and Twitter. Use the hashtag #HotSeat. Let us know what you think about problematic sexual behavior and any questions you might have for future episodes. Thanks.